My name is Dan Foley. I'm a physical therapist at the Wilmette Clinic. I have my student here, Jim, who's from the University of Illinois, Chicago. He will be leading most of the webinar today, but as you know, we're going to be talking about shoulder strengthening today and the importance of keeping your shoulder strong, and also how it relates to certain injuries. In clinic, a lot of the time, especially since the pandemic, we've been seeing a lot of shoulder injuries, a lot based on posture, on ergonomics changes as far as, everyone's workstation switching up. So Jim and I both agreed that this would be a good topic for everyone, because I think a lot of what Jim's going to go over today, as far as information, but also as far as exercises, are going to be really helpful for you guys. Just a reminder, as we go, Jim's going to run through his PowerPoint. So if you have any questions, please put them in the chat, and you can address it to panelists, or you can address it to panelists and all attendees. That way everyone can see it. So in case someone has the same question, maybe they'll be able to see the answer there. But we probably will go over questions towards the end. That way, it won't interrupt any part of the presentation. So if your question doesn't get answered right away, just know that we will look at that towards the end. And again, my name is Dan Foley. I'm a physical therapist here, and I'm going to pass it over to Jim.
Hey everybody, my name is Jim McDermott. I'm a student physical therapist currently at React Physical Therapy. I'm in 11 weeks into my first clinical rotation here. And as Dan mentioned, the importance of rotator cuff strengthening is something that I'm going to cover today. All right, so I'm going to share my screen with you guys. Okay. Do you guys see that? Okay, so do you see it? Yeah.
Go ahead. There you go.
All right, so as I mentioned, I'm going to talk about the importance of rotator cuff strengthening today. So before we begin, I want to talk about a brief anatomy. So the rotator cuff consists of 4 muscles that run from your shoulder blade to your upper arm. As you can see in the upper right image, you can see some basic bony anatomy. You can see there's a scapula, that's your shoulder blade. The humerus is your upper arm. The point where these 2 bones connect is the shoulder joint. In the bottom image, you can see all of the rotator cuff muscles individually highlighted in each picture. You can see how each of them run from the shoulder blade to the upper arm. The rotator cuff is important because it helps hold the head of the humerus in the shoulder socket. This helps with stability and maintains good positioning. The rotator cuff is also important to help assist with arm elevation and rotation, and basically plays a role in nearly every action you perform with your shoulder. If you have a weak rotator cuff, some of these impairments could happen to you. You can have movement impairments, rotator cuff tears, shoulder instability, dislocations, shoulder impingement, bursitis, tendonitis, even frozen shoulder, and more. One thing that can occur if you have a weak rotator cuff is the rotator cuff can get weak and then other muscles become overactive. So when that happens, you have a muscle imbalance. When a muscle imbalance occurs in your shoulder, oftentimes what happens is the humeral head will start to shift upwards and start to jam in some of those structures in the area. So some of the structures that can get jammed are the biceps, causing tendonitis, the rotator cuff muscles, which can result in a tear, some bursa, which can result in bursitis, and more impairments can happen. And this can lead to pain, decreased range of motion, and compensations. Another problem that can occur if you have a weak rotator cuff is instability and dislocations. Again, since the rotator cuff keeps the head of the humerus in place, if your rotator cuff is weak, it can be really lax, so the head of the humerus can shift out really easily. As you can see in the image to the right, here are some dislocations that can occur if you have a weak rotator cuff. Finally, having a weak rotator cuff impairs your ability to move your arm. This can be because decreased range of motion, weakness, pain, and compensations. As you can see in the image, this patient is compensating by his weak rotator cuff, you can see him hiking up his shoulder. You can see him leaning his trunk to the side, and you can see him turning his neck to get that last bit of range of motion. Although this may help him get to higher objects and help him reach, these compensations can result in more imbalances and problems in local joints and muscles. For example, if the patient continues to move this way, he can strain his back, his neck, or other shoulder muscles. If you have an injured shoulder, it may be tempting to avoid using your shoulder completely to avoid pain. You may just use your other arm to reach to perform movements with more ease. However, it's crucial to continue to move and strengthen your shoulder to keep the joint loose and the muscles working properly. The consequence of not moving your arm could lead to frozen shoulder. Frozen shoulder is when the joint gets very tight and restricted, so you can't move very well. This can lead to pain and significant range of motion loss and can take years to correct in some cases. So now I'm going to talk about how to strengthen your rotator cuff. Here's some simple tools that you can get anywhere for pretty cheap. We have a TheraBand, and you can see that I have a knot tied at one end and then a loop tied at the other. I'll demonstrate why in a second, why I did this. And then you have 2 light dumbbells. You don't want too much weight because you don't want to really strain your rotator cuff. It's just light, active, resisted exercise. So with the band I was describing earlier, for a lot of these exercises, what you're going to do is you're going to place the end that has the knot on the other side of a door. And then you're going to close the door so that the knot is on the other side. That way, when you're pulling on the band, it won't come through the door and you'll have it stable there. So I'm going to show the first exercise now. So you're going to stand sideways to the door, and then you're going to have your elbow at your side, and you're just going to rotate your arm inward towards your stomach. I'll show it again. I placed a towel roll in between my arm just for comfort and stability purposes. For the next exercise, you're just going to grab the band with your palms up, grasp it, keeping your elbows at your side. You're going to rotate your arms out and then pinch your shoulder blades together. I'll go ahead and show that again. It's really important that you focus on pinching your shoulder blades together. You can really feel it happening if you try to perform the movement right now. For the next exercise, you're going to stand facing the door. You're going to grab the TheraBand with your palm, and you're going to start with your fist pointing towards the door. Your arm will be horizontal, parallel to the ground, and then your arm will be bent at 90 degrees. I'll show it again. And then you'll just rotate your arm back like this so your fist ends up pointing towards the ceiling. Okay. For the next exercise, you'll grab 2 light dumbbells in each hand and you'll raise them away from your side. Your elbows should be straight and the movement should occur about 45 degrees from the side as shown. All right. In addition to strengthening the rotator cuff, it's also important to strengthen the muscles that stabilize the shoulder blade. Doing so will ensure proper positioning of the shoulder socket and will help with smooth, coordinated shoulder movement. So for the rows, you're going to hold the band with your palm facing down, and then you're going to pull back, bending your elbow, and then squeezing your shoulder blade back. Similar to the exercise before, you want to kind of pinch your shoulder blade back while bending your arm. So I'm going to show it again. You can notice that my arm is about 45 degrees from the side. This is a variation. You can have it higher up, you can have it lower down. I like it about 45 degrees just to get a good target of all the muscles in the area. So this will really hit your lats and your traps really well. Now this next exercise is a little difficult, but to perform this motion, you're going to get in a push-up position on a table. And then you can see that I'm dropping my shoulder blades so that the shoulder blades pinch together. And then when I come up, I separate the shoulder blades, okay? You should notice that my elbows and my back aren't moving with this motion. All of the motion is occurring in my shoulder blades. And then finally, with the pec fly, You'll hold the elastic band. You'll be standing to the side of the door. And with your arm stretched out to the side, you'll pull the elastic band horizontally to the center and across your body. When you're doing this, your arm should be straight or slightly bent. In conclusion, rotator cuff strengthening can prevent shoulder injuries from occurring, and it's also effective for treating active shoulder impairments. If you're experiencing any issues with your shoulder, please contact a React physical therapist, and they'll set up a plan for you. Thank you very much. And then I'll see if you guys have any questions. So for sets and reps, it's really dependent on the person. However, generally 3 sets of 10 works for most people. Stop the show. There you go. So 3 sets of 10 typically. Any more questions? Yeah, for a body blade, that's a great shoulder exercise too. Typically, you can just hold it forward and shake it back and forth. That'll start working the rotator cuff and working on stability a lot. You can also bring it to the side, do the same motion. You can hold it up like this, go up and down. I'm actually going to I'm going to have Dan send an exercise program that'll have everything listed out. It'll also have the reps, the sets you should do, and it'll have a detailed explanation of all the exercises. Recommend exercise with weight instead of band. Yeah, so the scaption one with the weights that I had would be good. External rotation you can do. You can grab the weight just like this and move in this motion. You'd also do it laying down. Internal rotation is kind of hard to do without weight, but if you lie on your back, you can do that motion. Pull machine at the gym. So a lot of those exercises can be done with the cross cable pull machine, pretty much all of them actually. So you can still do the internal rotation. You just do it the same way as you did with the band. You might have to set up the height to be in line as it was in the pictures. So you can go back to the video, see how everything was kind of set up. But really you can do the internal rotation, the external rotation. You can do the raises and you can do the rows and the pec fly with the cross cable machine. Someone wants to know if they can purchase a Goni through React.
I do not think we sell goniometers through React. If you're a current patient now, that's something you can ask. I know at our clinic we do not, but whoever your therapist is, if you're seeing them now, you can certainly ask them and see. But I know here we do not sell goniometers. And I just want to reiterate a last point Jim made. I think someone asked if they could get all these exercises. What I'm going to do is, as most of you know, if you've seen a webinar before, we post recordings, and I think typically they're emailed as well. So I'm going to work to get a PDF document that Jim made to also be included in that email blast, which as he said, I know we went through them briefly today, but there's going to be pictures of each of them as far as sets and reps for each of those exercises. But yeah, sorry, Michael, we do not sell Gonies. Sorry about that. Does anyone else have any other questions? We got some time here. All right, well, it doesn't look like it. Again, thank you all for coming to the webinar today. I hope you found it beneficial. Jim went through a lot of good exercises here, and I think our point is, with PT, it's not always about being reactionary when you have pain to do them, right? It's more important sometimes to get ahead of that and to get ahead of those issues. Rotator cuff issues, shoulder pain in general is really common. So getting ahead of them and keeping it strong, 3 to 4 days a week is important. I just got another question. What do we think of muscle ups CrossFit style? Bad thing to do. You don't do CrossFit, do you?
I do.
Oh, well, here you go.
Well, yeah, I do muscle ups time to time. It really depends on, like, can you guys see me right now? Oh yeah. It really depends on your level of fitness. I mean, you gotta have a strong rotator cuff to be able to do those exercises. So I'd really recommend not to do those exercises with the intention to strengthen your rotator cuff, but you could do them if you think that you have a strong shoulder. You just have to have a good coach. Any more questions? If not, I really appreciate you guys coming to listen to what I have to say. You guys were a good audience, and you asked very good questions. So thank you very much.
Yeah, thank you guys for coming out. I'm going to end the recording here. You guys have a good day.